Some people maybe good morning. I want to make sure that we're starting all good. All right, I'm going to dive in. Thank you all for joining us. This is a fantastic way, I think, to kick off the year. Arif and I were just talking, can't believe we're 11 days in. It probably seems like a little bit more for most of us. But I can't think of a better way to start by us coming together and really talking about how we surround family caregivers with support. So, Arif, thanks for joining me today. I am so grateful, beyond grateful for our partnership. And I think the power of us sharing our collective resources and then bringing in other resources so that we continue to surround those family caregivers with support has been really powerful. So I'd love to dive in. I would love, Arif, like we talk about this all the time, right? You and I talk and our teams talk about understanding the true challenges that family
Yep.
caregivers are facing. So what are you seeing both at the American Cancer Society and in your own practice?
Yeah, well, let's first start talking about like the kind of what's evolving in cancer care itself, because I think that'll set the stage really nicely. So, I think when people picture what cancer care looks like, it's actually different than maybe what we've thought about 20, 30 years ago. Oftentimes people think of a person who is bedbound with a lot of nausea and vomiting and fatigue and losing their hair, and there's a particular sort of set of opportunities and challenges for a family caregiver in a situation like that. And they may think about particularly the time limitedness of that episode. And fortunately, for many cancers, what might have been 6 years or a month of survival, particularly with advanced disease, let's say 5, 10 years ago, is now fortunately becoming a lot longer. And what that does is it really means that, like other chronic illnesses like heart disease and liver disease and so on, where we really well understand the longitudinality of being a family caregiver, that's now becoming an issue in cancer care as well, where we're thinking of cancers where people are living for years and even decades. And what we have to recognize is the family caregiver is also part of that story now for years and even decades. So even as we thought about issues where maybe resilience and burnout wasn't as such a big a thing when a journey is maybe measured in months, well, now it absolutely is. And the same thing about social drivers and financial concerns and social isolation and these other concerns become compounded when that time period gets longer. I think the other thing that's really important to recognize that's happening in cancer now is that the other side of innovation is uncertainty. And what do I mean by that? Well, if you watch a big football game, you might see a commercial for a brand new drug that's come out. If you look at FDA actions, you'll see that there's an unprecedented number of FDA approvals for drugs, specifically in the cancer space. In fact, more drugs have been approved for cancer in the last 10 years than in all other diseases combined. That's pretty remarkable. But what that means is there's a ton of promise and a ton of innovation. But what we haven't gotten a lot better at is being able to look an individual in the eye and say, I can guarantee this thing is going to work, and it's going to work for a long period of time or some period of time that we can promise. What we've done is introduced a lot of innovation and opportunity, but what we haven't solved for is uncertainty. And what we know is that family caregivers oftentimes are the ones who are holding that uncertainty, must respond to it, are oftentimes talking about that with their community members. Imagine, a well-meaning community member says, well, so, things are going well, right? Like that trial's going to work, right? Like that's, and, you want to be hopeful. And at the same time, as a caregiver, that level of certainty doesn't exist. And so that's the opposite of the innovation that we have to just acknowledge is happening in cancer care right now.
That's really good. I'm going to bridge or pull through that uncertainty because I know I certainly have experienced it and seen it both in my loved ones and as myself as a family caregiver of someone going through a cancer health journey. And I think there's that acute moment of overwhelm. We call it overwhelm at CaringBridge. And that feeling of being overwhelmed then leads to isolation, loneliness, because you feel like I'm carrying, you talked about, I'm carrying this around with me.
Right, right.
And when I think about that longitudinal, that the good news that people are, the treatments are longer, the survival rates are higher, but that doesn't negate that holding that space of that feelings of overwhelm. And when we recently did some research here at CaringBridge, and we found that 40% of those caregivers report feeling isolated and unsupported. And meanwhile, we know that there is this community that is actually around them waiting to help. But the hardest thing is to ask for that help and to activate alleviate some of that overwhelm or feelings that you're feeling as you're helping and surrounding that loved one through a health journey. So I'm curious. You and I talk a lot about what you see in your practice, and
Yes.
so when you think about, oftentimes caregivers handle it alone. They truly do, and it leads to a ton of implications. I do want to say, I know that, well, two things. I'm going to say two sides of the coin. What we know is when family caregivers are involved, right, they're driving better outcomes.
Yep.
In fact, I think one of the recent studies we looked at said primary care providers, when a caregiver is involved side by side with that patient in their treatment plan and in their care, there's 88% better patient outcomes.
Mm-hmm.
And 56% lower hospital readmission rates,
yep.
whatever you're facing.
Yep.
The flip side and the implications that then I want to hand it back to you to see what you are seeing is that those caregivers often are reporting health implications, 20% reporting negative impact on their physical health and 40% on their emotional health. And that's significant. So I'm curious. We've got two things going on here. People are feeling isolated and like they've got to carry it all, and yet they have resources probably unknown and people waiting to alleviate some of that. What have you seen, and how have you addressed it?
Well, let me first say, as a clinician and as a caregiver, I'm not only a fan of CaringBridge, but I've been a user of it too. And I think that, solutions like that are really important. One is that there has to be moments to reflect and for some people to share. But I think the reflection part is really important because, caregivers are holding both immense gratitude and a sense of privilege, right? There's a lot of ways you can describe a position where it's just all a lot of really stress and badness. But when I talk to caregivers, who are I see that as a team-based approach to cancer care. It's the patient, their caregiver, and me as the clinical team. So when I'm talking to them, it's really like, who's seeing them, who's acknowledging them, who's talking to them, and how are they holding this immense sense of privilege and honor, and for many people a sense of duty. And I don't mean that in a bad way. I mean they feel this sense of like, my parent took care of me, this person took care of me when I was in any number of ways, and it is my honor to do the thing in return. But at the same time, you're holding this idea that it's not always easy, and yet it feels like a very fulfilling and honoring thing to do. And holding both things at the same time, I think, it's easy when we describe one side of something, but that's a clear example when both things are true. Both things are true. So I think, for the isolation piece, I think this is a skills issue. One, on the clinician side, I make sure in my practice, and as I teach other people, I don't do it always right. So let me be the first to say this, but maybe I strive to do this well more, is this idea that there are things that I want to talk to with the patient, things I want to talk to with both of them together, and things I want to talk about with the caregiver alone. And I pull that to say nothing secretive, but if I ask the question, do you feel overwhelmed in being a caregiver? The answer could be yes, but they're not going to answer that in front of their loved one. Now, there is nothing disrespectful about that answer. It is just the reality of where they are, and what it is an invitation to try to help this person by first understanding that's kind of where they are. And if that's not me asking that question, we have to be committed on the healthcare side that someone is asking that question. And, in work that I've done before with, registries and things, we've really operationalized that question of, do you have help when you need it as a caregiver? That one question actually can get you pretty far. I don't think it's the question. It's just a question I've used in my clinical practice. And if they say, no, I don't need it, now that's a flag for me, because it says, okay, maybe, but maybe there's an opportunity. And if you don't have it, like, okay, is this the eldest daughter who's carrying, the majority or of the work. And I've seen that in my practice. Oftentimes it's the eldest this, or the closest this, or the, the the whatever that is. Maybe it's the daughter and not the son. It's the person who lives 2 miles away, but the person who lives 200 miles away. And so there's sometimes inequities in sort of how those caregiving responsibilities are divvied up within a family. And so even saying, like, giving them, the engagement to say, hey, have you talked with your other siblings? Because this is a lot. Or have you talked to others who are there? They would want to help. And I think that the language to use that is part of kind of the healthcare side. But I would also say in the general population, if I said to everyone right now, get on your phone, open up the text, and send a text to a family caregiver right now, expressing your support, maybe an offer for help, that you're thinking about them, whatever that is. I could tell you that might be the hardest text that you would send today, and maybe one of the hardest things you would do. And I'm an oncologist, so I think that maybe I might know how to do that. But there's nothing that would give me more pause than to figure out what's the right thing to say. How do I say it? How do I acknowledge care and concern without seeming nosy? How do I offer help that's genuine? And, I think that there is literature out there about how to do that. I know people know best practices around that, but I don't think the average person knows, for example, that a specific offer of help is much more valuable than a general sense of I'm there for you. For example, it's not, hey, let me know if I can do anything for you. No, it's more like, hey, I'm picking up pizza on Friday night. Do you still like pepperoni? Because I'm going to bring it over. Yeah. And then right, that's an invitation for them to say, oh, we already have plans for dinner on Friday, but thank you. That's a real offer. Or any chance you're doing something on Saturday because I could use a little help. Or no, I don't eat pepperoni. It's going to be veggie lovers for me. See you in a couple hours, right? But all of that gets to this sincere, genuine interest in wanting to help, but it provides a tangible thing for someone to react to.
I really like how you're bringing that to life. So at CaringBridge, one of the items that we know from our caregivers is that 2/3 of those requests, most often it's for emotional support, but it's also that tangible support, but it's maybe buried in a update, or it may be buried in a conversation, right? And so that ability to pick out what that need is to deliver on it, and you're talking about a more definitive, not how can I help? We know that how can I help, and trust me, I've done it so many times.
Yeah.
I'm trying to eliminate it from my language.
Yeah, we all do it.
Forward, right? Because how can I help puts the burden back on the person that you're asking, who is dealing. And I actually have an example. One of my best friends, she lost her father, and in that moment, I was a 3-hour drive away with all the things that go on in your own life, craziness right now. And so I was like, gosh, should I go? Should I not? When does she need me? So here I am trying to decide. And instead of just going, I will be there on this date and I can see you between this time, I was like, do you need me and how can I help? Mm-hmm. And I remember her very great response was, Tia, I don't know if you can help and I don't know what I need, but if you show up, I know I'll have something for you.
Yeah.
Now she had the fortitude to say that in that moment, right? A very overwhelmed moment.
Yeah.
But I think it's definitely like, just state, here's what I'm doing here. And I love how the pepperoni pizza is a perfect example, right?
Yeah.
It still gives the out to the person that you may not for the help, right? Which is also alleviates some of the, no, don't come over now. This isn't a good time. And no, I don't need all of those things, right? So what I am noticing right now, so let's go back to that overwhelm. There are so many things already on the caregiver's plate as they are alongside their loved one in that health journey. And I'm excited because when I look out in the industry, there are a plethora of new resources coming on board to help and surround caregivers. Mm-hmm. And yet they are so overwhelmed that what we see even at CaringBridge is if it's not simple and if it's not integrated into their life, that it's really hard to even show them the resource and get them to go, yeah, I think I'll use that, even if it's free. Anything. And there's so many great resources out there. So it's very crowded and it almost increases the overwhelm.
Sure.
So I know ACS has been doing some great things and developing some
Yeah.
some tools, but I'm curious what you think of the landscape and how we can, I guess, get better at not overwhelming the caregiver even more.
Yeah, I agree. There are multiple tools out there. One, as I mentioned, I'll say it again, I'm a big fan of CaringBridge for this purpose. I think that people should find sort of the right fit for them. I find writing things down and sharing with other people to be helpful. And I do think, as you're pointing out, is thinking through what's within what someone's writing. Is there sort of a call for assistance in there? And I think as we think about communicating on both sides, getting to a level of clarity there can be really helpful. I think things we're working on. One thing we're really excited about is for the first time ever, health systems will now have a CMS reimbursement for non-clinical navigation through navigators that are non-clinical, which sounds like it's a negative thing. Actually, it's a positive thing. It means the people who have lived experiences similar to yours. That's really the purpose. So sometimes the term used for this is community health workers or peer navigators. The idea is that someone like you who's from where you're from or has some commonality with you, and that's not what's not in common is that you're both in the same exam room, because that's about the most I might have in common with a lot of my patients when I put on my white coat, is that we're sitting in the same place, sure, but someone who's like you is now professionally and being paid, and there's a reimbursement mechanism for providing navigation services. Now that rule went into place January 1. So we're 11 days in, and maybe a lot of people are like, wait, what? And I'm like, I hear you. I hear you. It's a brand new thing, but it's a real thing. And at ACS, we're very interested in, helping build the capacity for this work that involves reaching out to health systems and community-based organizations and health departments and so on to help them build these programs, right? I mean, we're here for that and to train them and so on. But what I would say is, if you're going through a cancer journey and you're a family caregiver, maybe put a little pressure on the health systems you're working with. And I don't mean that in a negative way. I mean that, now that there's a reimbursement mechanism, this isn't a nice to have. This, I believe, navigation is a have to have. And it's so complex to navigate through this. I think, right now we underappreciate how hard it is. And I'm a physician, but even when I'm trying to access healthcare, right? Like I get put on hold too, and then I get hung up on as well. And I don't know who to call either. And I might work at the place that I'm calling, right? So we just have to acknowledge that healthcare was not built to be person-centered. It was built around lots of other motivating factors that were part of its build. And I think it's becoming a bit more user-friendly, maybe. But until it becomes that, which it is not now, those navigators are really important. The other thing I'll add is that, ACS launched its first ever patient and caregiver facing app about 6 months ago. It's in the iTunes Store and Google Play Store, and the app's a free download. The idea is to create networks of peers amongst each other, to talk to each other, to get tailored resources, either ones we provide as an organization or others like CaringBridge provide as well. You kind of tell us who you are and give us your zip code, and we'll show you what are food banks where you live, and what are maybe support groups and other things about where you live. And last thing is curated content so that you have the right information about what you need there. I think that, again, as I said from the beginning, this idea that cancer is evolving. It's becoming a marathon more than a sprint, and that's not what most people sort of appreciate now. Is that it feels like a sprint? The thing though is that distress, particularly for family caregivers, is generally a function of time, not necessarily a function of resource. So you might say, look, I just got diagnosed with cancer. I've got all the friends in the world. I've got all the money I think I would need. I've got all that I need. And I hope that's true for most people. I run into patients where that's not true. But let's start from there. Take that and add 6 years. 6 years from now, after a function of time, some of those things that you started with will not be true anymore. For example, social isolation is a very insidious thing. Actually, it doesn't happen overnight. Let me give you an example. Joanna just got diagnosed with cancer, and her husband, got a lot going on right now. So, we would normally invite them to the Super Bowl party, but they've got a lot going on. So we're not going to invite them to the Super Bowl party. And you're like, wait a minute. they're not getting chemotherapy. Their blood cells are fine. They're not at high risk for infection. But remember, that's the old way I think about cancer. But now that we don't invite them to the Super Bowl party, guess what happens at the Super Bowl party? Everyone goes, so-and-so's 50th wedding anniversary is coming up and we're all going, and the invites get handed out there. And then now this person's not invited to that thing, and that thing, and that thing, and that thing, right? It's that isolation begets isolation, right? In that sense. And you can see that. We learned that, for example, from COVID, right? Like once people stop, for example, if they went to church to worship, once they stop going to church, then the invitations for the thing after church, the brunch after church, that stopped, right? Those kinds of things happen. And that happens in cancer care too, particularly for family caregivers, is once you're not invited to one thing, then nothing. And there's this myth. The myth is they've got a lot going on. They could get sick if they're around people. And that may be true, right? But I wouldn't presuppose that it's true for everyone. In fact, when patients come to me and they're like, Dr. Kamal, I was in clinic yesterday. I had a patient who walked in and I said, hey, I noticed that you keep coming in. We can make these telehealth appointments if that's easier for you. And they said, no, I come to see you because you care. And it's the only time I'm really interacting with another person in my day. And that was a really powerful moment to realize this person is parking, waiting in my waiting room, coming to talk to me for 20 minutes, 30 minutes, because they want connection. And I value that a ton. I value my patients a ton. I value that a ton. But it should signal this idea that really all this is going on and the person's looking for connection in healthcare, when really we have to think about their connection across their community and other places too. Really important.
Yes. And I think when I think about CaringBridge and I am honored that I inherited this legacy platform that was invented, the internet was 3 years old at the time that our founder went down and coded the first CaringBridge page. And it was born out of what you're talking about, which is the need for connection and the need to activate your community and connection so that you're not isolated, because there's so much going on. But how do you, and you see this, in those in-between moments, maybe in the waiting room, maybe bedside, whatever fits into your life to connect with that community and then ask them to support you in the way that you need. And that, as we see on CaringBridge, right, it can be anything from a prayer emoji to an actual comment to an actual, I'm bringing that pepperoni pizza today at 2:00. Do you still like pepperoni? Right? All of that exists in CaringBridge. And I think that's the power that's enabled it to last so long. Yeah. What I appreciate about what you're saying is that that activation of community is so important to solving isolation long-term as well. What we see, I'll bring to life an example that, there's that kind of that acute moment at the beginning when you really need your community to understand and know what's going on. And there's a communication overload of people inundating you with asks. And so that's where CaringBridge solves that. Yeah. But further on down the line, as you get through your treatment, as you get through those great milestones of remission, 1 year, 3 year, 5 year, we see people pulling my year in review, what I'm grateful for. Yeah. And it reignites and it reminds them of what you're talking about. I'm not sick anymore. Mm-hmm. And I'm still here and I still need you. And I don't, it's not about my cancer anymore. It's about me as part of the community. And so we see that long tail on CaringBridge, which is really powerful and speaks to what you were talking about. I'm going to close and ask you what you feel. You've sprinkled in little things here and there, but what do you feel is powerful about the partnership between CaringBridge and ACS, and just kind of maybe a summary of why you think that's a powerful combination of what we can do to continue to help those family caregivers and their loved ones.
Well, I mean, one, when two organizations like ours come together to say this is important, then I think that's an important place to start. Family caregivers have for too long been ignored, been in the shadows, been not heard, not listened to, not acknowledged for really the work that they do. And I think we all know that, Rosalind Carter said it best, there's only 4 types of people, right? And you move between those groups, but all of us will be a caregiver or need a caregiver at some point in time. I think there's few few absolutes in life. Maybe it's death, taxes, and the need of a caregiver or becoming a caregiver, right? Like, I mean, that's really just an absolutism. And I think when two organizations of our size and visibility come together to say this is a extraordinarily important thing and not pay lip service to it, I think that's really important, for one. Two, I think what it does is it invites collaboration and ideation and thoughts. I mean, in starting this role, I thought about CaringBridge really early on because I think we're starting to acknowledge this issue both of gratitude acknowledgement and of social isolation that COVID only just hinted at. But the concept of cancer and social isolation, I still get people who say to me like, really? I thought everyone rallies around a person when they're diagnosed with cancer. And I was like, for some very fortunate people, that is true, but not for everybody. Come to my clinic, you'll see that. But that rally doesn't last. It might last 6 days. It might last 6 months. It rarely lasts 6 years. And, that's really important for us to address together. So, I encourage everyone to journal about their experience, share that within a network, share their gratitudes, be upfront and honest about what they need. Because if you don't ask, then all those people who care and love you can't help you. And I think that language can be tough because asking for something might be admitting something, but I think it just admits that we're all human. We all need something. And there's moments in time where we may need a little bit more than other moments in time. I think that's really important. And lastly, I would say, Tia, that the power of our relationship is to improve lives. I mean, I think that we both have a platform where we can reach millions of people in a given year, and I know you do, and we strive to do that as well, but reach in different ways. I mean, I think that for some people, social determinants of health can be thought of as a really expensive solution to something that are formidable barriers. But I do think that the power of connection becomes a scalable, potentially lower cost. I mean, we're not talking about that the solution starts with someone gives someone else $3,000 in a grant. I think that historically has worked sometimes for sure. But this is one of those, like, if you know how to send the right text, you will make a difference today, and that's free. And if you know how to journal in the right way and you're reading up on a loved one and you can see what they're saying and you make that connection, that's essentially free. And I think that's what we need to think about here, because there's millions of caregivers, lots of chronic illness, and we have to find ways to amplify through our voices, and I think that's how our organizations are doing it.
Yeah. Well, thank you so much for joining. I think about CaringBridge Vision of a world where no one goes through a health journey alone.
Alone. Yeah.
And that is exactly what our organizations are focused on, right? How do we surround you with those, not only resources, but the people? And I love how you honed in on the words and the resources and getting those simply. And I was scrolling through, thank you guys all. There's a lot of comments that were coming through. I was quickly scrolling through to see if there was any specific questions, but a lot of just support and a lot of, I saw a couple comments as we, actually, this is not new, by the way. There is a new term out there, hospital at home. It's not new. And for all of you caregivers, I was looking at nurse practitioner comments and other people, like, that has always been a thing, and the caregivers are the ones that were absorbing it. So I think between our two organizations continuing to support that reality as it's finally becoming something that is being highlighted, that, hey, this is more and more, it's healthier, patients are healthier, but they're forgetting that the caregiver oftentimes isn't healthier because they still are taking on all of the needs and care. And so that's, I think our organizations are looking at that very differently and saying, how do we surround that caregiver with support so that they can continue to provide that very important support?
Well, in some health systems, 10 to 20% of their cancer care delivery, I mean, chemotherapy through a bag, is actually happening at home. And so we've been talking for a long time about cost sharing, right? When we think about insurance, like how much is the patient paying for their insurance, but right. But here we're talking about effort sharing, this idea that there may even be effort transitioning, that if you were in a cancer center getting chemotherapy, that it's a medical assistant, it's an LPN, right? It's someone who's sort of there. Now what you might be doing is asking caregivers take a day off from work and stay at home and make this happen. I think there's a lot of opportunity for person centricity in that approach, because frankly, that might work for me to do this in my home. But at the same time, you're now asking my family, my caregivers, my neighbors, and others to pick up a level of burden and responsibility and work that they may not have to do differently. And I think we both feel very strongly that needs to be acknowledged. And however that gets executed, so that person centricity is not a trade-off for making someone else do the work.
Yeah. Well, we could talk, I know, for a long time about this. Thank you, everyone out there that in your comments and for joining. Arif and I are, very public, and so you can find us. And we would love any other questions and comments as we think through how to better surround all of our caregivers with support as they are supporting the loved one on a health journey. So, Arif, thank you as always for being a great partner and a great thought leader in this space. Thanks for all you do.
Likewise, Tia. Take care.
Thanks.